Deep brain stimulation is the newest device that we're now using for refractory epilepsy. It's used to treat patients 18 years or older with focal seizures who are of drug resistance, which means they've tried at least two medications and continue to have uncontrolled seizures. Basically, it works by putting a neurostimulator device in the brain, usually in the thalamus, and that there's a preset cycle in which it emits a trick stimulation. And by doing so over time, it's supposed to prevent seizures because that electrical current that it emits is going to do some neuromodulation work to reduce the excitability of certain circuits of the brain. It seems to be efficacious. About half the people do have less seizures with this treatment. However, DBS might not be the right way for everyone, and it might not be the right option for everyone with focal epilepsy. Usually, if you are a candidate, your case will be presented at a surgical conference, and the surgical conference is where the neurosurgeon and all the epileptologists sit together and decide if you're a good candidate or not. If you do get it, there recently was this study, which was a registry of patients who've had DBS put into the anterior nucleus of the thalamus for drug resistance epilepsy. This showed that most people had at least a third reduction in seizure frequency, and in a certain subgroup that followed for even longer, the seizure frequency decreased by half. Patients who had their surgery done at a high volume center did much better than those at low volume centers, which is a 42.8% reduction versus a 25.8. So overall, I think DBS is helpful. It is one of the newer surgical modalities. It's one of the newer device modality. I think definitely need more time to determine positive outcomes, but overall, so far the data looks good. If you're someone with focal seizures or focal epilepsy that has been refractory to treatment, I think this might be a worthwhile option. If you are a candidate, again, if you're a candidate, it needs to be determined by your epileptologist and your surgical center. Definitely talk to your doctor about it to see if this is something that can be explored.